Autism basically is the disorder of communication. The child is unable to communicate with significant others around him, verbally or non-verbally. He's unable to have eye contact, social reciprocity is missing, and he may have certain strange and repetitive behaviors, like hand flapping is very common in excitement. So autism, basically the biggest differential is that it encompasses a lot of areas, not just speech, also social reciprocity and behaviors are affected. Whereas in most other disorders of language and communication, the child's biggest deficit is in the area of communication, but he is able to interact interactively with other people. He is able to be part of a larger social group effectively enough. Only thing missing is speech and language. So it's very important to diagnose and make sure that you're diagnosing autism correctly, because the deficits have to be in multiple areas, not just in the area of speech and language. Autism treatment normally is a 3-step process. So the first step is for parents to approach a therapist or a psychologist so they can understand the diagnosis better, understand what autism is, how it affects various areas of functioning for a child, and deal with his behaviors more effectively. The other area which requires treatment, of course, is communication. This is done by a speech and language therapist who will address the communication needs of the child. It may even start with getting the child to express his needs non-verbally and then progressing to the verbal side of it. The third treatment area is sensory integration therapy. Because sensations are affected in autism, where a child may feel less of certain sensations and feel other sensations much more than required, there has to be a balance achieved in these sensations. This is done by a sensory integration therapist who could be an occupational therapist as well. And once there is a balance in sensations, the child is able to focus much more effectively on his other therapies.